welcome to this special presentation of Sanjeevani United Against Cancer, a campaign through which we are empowering people to take action to beat cancer. The reality is that in 2023, close to 15 lakh people were diagnosed with cancer, out of which approximately 2 lakh cases were of breast cancer. In fact, some studies have shown that a striking 25% of breast cancer cases amongst Indian women occurred at the age of 39 or younger. Unfortunately, in today's day and age, we all know someone who has been diagnosed with some type of cancer, if not breast cancer. However, we don't know what living life with cancer looks like. The silver lining here is that medicine is also advancing as the cancer burden increases. In fact, over the years in India, the 5-year survival rate after a breast cancer diagnosis has increased from approximately 40% to 60%. This can be a solace to many, especially if you or your loved ones receive a diagnosis. With Treat to Beat, our initiative with Novartis India, we aim to drive meaningful conversations and activation towards better outcomes for breast cancer patients. We are here to tell you that a breast cancer diagnosis does not mean the end of life. Many people, even with a late-stage breast cancer diagnosis, are able to continue living their life with dignity and positivity. On that note of looking towards the future with determination and hope, let's begin our discussion today. Let me invite our esteemed panelists, Dr. Neeti Raizada, Senior Director, Medical Oncology, Fortis; Aatushi Deshpande, Breast Cancer Warrior; Amitabh Dubey, Country President, Novartis India; Dr. T. Raja, Director of Medical Oncology, Apollo Cancer Center, Chennai. Welcome to the show. Well, let's start with you, Aatushi. No better way to start this conversation than with you, a cancer warrior. Tell us a little bit about your journey with cancer.
So it's been an 8-year-long journey. I was diagnosed in 2015 for the first time. I've had 2 recurrences after that. It was a shock in the beginning. I cried into my pillow 2 nights running when I was first diagnosed because I was a healthy individual. I had never had any issues. And then it was all about picking myself up. Okay, now this is a new journey. It's a new story. What do I do? How do I take it on? What are the challenges? So it was just a new chapter started, a new, way of life started. And I think somewhere, because I've always loved challenges, I took it on like another challenge that I had to handle and surmount and overcome. And in which, yes, the medical way played a big part. And as an individual, I had to, pull up all my resources and say, what can I do? Because finally, it's me and me alone, So
I think it's a lot about the mindset which you've spoken about. But if you could just give us any kind of misconceptions that you might have had before diagnosis, post-diagnosis, during treatment.
So I think one of the misconceptions is that the treatment will devastate you. That was not the case. I used to find a few days when I was on, treatment slightly low. But then you can even compare it to something like if you got a bad case of typhoid or jaundice or viral, then also you feel sick, right? I'm currently going through treatment as well, and I'm on continued targeted treatment. But the thing is, there are days and then there are good days also, So you juice life out the best you can, every moment you get of the good time, or you try to come on top of it, because it's just the thing is, life is a terminal condition, and cancer people know it better. That's all. So you, live up to every moment. You take on everything. And I think also the thing comes because I've always trekked in the mountains. I've always been an adventure-loving person. The surprise element, the mystery of life. I love life. So all of that and, everything I think helped me. Support from my family. All of that is also very important. You have to believe. You have to have that faith that yes, if you don't believe in a positive dream, how will it ever happen? Anyway, it's all future projection. It's all lying in the future, So might as well believe the better of it than the worse of it. How can I keep my spirit up? How can I really, stand up and smell the coffee and everything.
Smell the coffee, smell the flowers. You probably manifested the positivity in your life. But Dr. Neeti, just wanted to come to you about it. How important is the patient or the caregiver's role when it comes to treatment?
I would say they are the primemost. It has to be centered around the patient. Now, one is that they need to know about the disease right from the beginning. They need to research and ask the right questions to the doctor. It is a patient-doctor partnership which plays along the way. It's how they, as she rightly said, how they take the disease, how they kind of go through the journey of management of cancer. Probably right source of information is very important. So ask your doctor whether there are any reliable source which I can read, whether they can do some breathing exercise during that time or some physical training during the time. If there are support groups which manage things very well, if there are patient-centric needs like a travel issue, they have to come from a far-off place, even a financial need, if somebody has to come along and the caregiver has to take work day off. So all these things have to be managed during the course of treating the patient. And all these small things actually play a very long role because it's not just the patient, but the suffering is around the family. The caregivers are also going through their own journey. So both have to be managed, the patient and the caregiver. So the entire social support system and the hospital or the facility which is giving that support is very important.
Okay, all right. Well, let's get Dr. T. Raja into this conversation as well. Dr. T. Raja, the risk of reoccurrence for early breast cancer patients globally is cited at anywhere between 10 to 30%. How does one combat living with that fear of reoccurrence?
Yeah, it is true that there is always, the hanging sword. 10 to 30% is a general statement. But on the other hand, the rate of recurrences is not common across the spectrum. It varies depending on the age group, depending on the type of breast cancers. If you know what is the disease that we are dealing with, what is the age group that we are dealing with, we can look at some very specifics to see how we can, stop this recurrence. There are something called modifiable factors when you have a disease. In breast cancers, for example, the race, ethnicity, and the age at which you achieve menarche or late menopause are not modifiable. They are all inborn. You are born with that. But there are certain other things that can be modified. For example, you can take care of your weight. You can take care of your diet, healthy diet, and obesity reduction. And a simple thing like spending some time on exercise is all very important. They have been already proven to reduce the rate of recurrence. Simple things like avoiding alcohol and exposure to tobacco also helps, even in breast cancers. Even in recurrences, if you are able to catch them at an earlier situation, you are better off. So a regular follow-up, one can't emphasize more on that. We must educate the family, we must educate the patient, and try to see how to make sure that their follow-up is as good as possible. So these are all the things that we'll talk to our patients.
Okay, all right, fair enough. Well, Amitabh, let's come to you now. The theme for World Cancer Day this year was closing the care gap. And that is something that our panelists have alluded to as well in some way. As a healthcare organization, how does Novartis view this?
First of all, thank you for the question, Ekta. It's such an honor to be here on this panel. It's very meaningful when you talk about treat to beat. At Novartis, our purpose and visions go very, very close with closing the gap. We reimagine medicine to improve and extend patients' lives. Over the last couple of years, we have been spending heavily to innovate, discover, and develop newer treatments which can bend the curve of life for patients with diseases like cancer, cardiovascular diseases, and rare diseases. We believe that we have to partner very, very closely with governments, insurance companies, multiple stakeholders to ensure that we are able to provide these meaningful treatments to patients across the country. Having said that, we also want to acknowledge the efforts that government has done in the last couple of years. A couple of data showed that they've been investing heavily on early screening, and about 32 crore people have been screened for oral, cervical, and breast cancer. They're investing on infrastructure, which is also one of the requirements for ensuring that we close the healthcare gap. And we see that the private players are coming in with public-private partnerships. We also see that they are making meaningful changes in the way tax structures are looked at, especially cancer patients and the treatments are getting tax exempted, which is also allowing less financial burden on the patients. However, medicines and treatment is just one part of the spectrum. The total spectrum has to have many collaborative partners to come together if we really want to close the gap in a country like India. We have to get healthcare professionals together. We have to get infrastructure in right place. We have to get patient organizations. And we have to get pharmaceutical companies all committed together. The importance has to be that a patient has the ability to reach to a right doctor at a right time and get the right treatment. And that would be the treat to beat for us at Novartis.
Okay, all right. Thank you, Amitabh. It is definitely going to require a collective effort to close the care gap for cancer and breast cancer patients. On that note, it's time to slip into a short break. Stay tuned. We'll be right back. Welcome back to this special episode of Treat to Beat, where we strive towards better outcomes for breast cancer patients. One of the things we often hear from people is that they don't want to screen for breast cancer because if they get diagnosed, there is no hope. Let's discuss this further. Well, Dr. Neeti, you have around 20 years of experience when it comes to treating breast cancer. Give us a sense in terms of what are the shifts which have taken place when it comes to treatment of breast cancer.
Actually, I would say there has been a paradigm shift in the way we look at the presentation of patients and how we treat. Now, 2 decades back, there were patients of more advanced malignancy with poor compliance. And yes, this myth was very prevalent, that most of the time if you're diagnosed with cancer, that's the end of the journey. But now we look at it in entirely a different way. It's just the beginning. We have younger patients, as you rightly mentioned in the beginning. We have women in their 30s who are diagnosed, early 40s who are diagnosed, and at least in urban practice, that's the predominant age group. So we have more younger women with early stage breast cancer being diagnosed. They are screen detected cancer, smaller cancers which are easier to treat. The compliance is better because they are well educated, they comply better to treatment. Therefore, the results are also much better. There are newer therapies, the supportive care drugs are better. So we would hear about pain, we would hear about suffering, vomiting, those things are not there. Even in a new patient, we do at least some basic markers to precisely direct treatment differently for each woman with breast cancer. We'll have more specific techniques in later stages where we can change the therapy for one particular patient. So personalized care. We have precision drugs, we have precision radiation, we have precision surgery, more organ conserving surgery, because as you rightly said, survivorship is predominant now. Breast cancer has the largest number of survivors, people living with cancer. So we also have to look at the social and psychological aspects later on, because they have to lead a normal life. They have to be in what they are normally doing for an entire lifetime. Social support groups are better. People talk about it very often. It's not a stigma in which you hide under something. So they talk about it. That's the reason they are well informed, and the other patient also does well for the similar reason.
Well, Atishi, your story has undercurrents of what we can say is hope, belief, as well as trusting the entire process. And obviously your positive mindset towards it. How much was your positive mindset key in terms of this journey?
It's not like I was just, positive from day one. It's something you have to inculcate. So I used several tools, and I'm a great proponent of meditation, of yoga, because finally, suffering is in the mind. It's a mind projected thing. Most of the time we are living in the fear that's not happening. So if you're going through treatment also, it's good to have hope, and it's good. What happens with cancer is it has the potential of making us live life even more fully, because you realize it is limited. It's limited for everybody in the world. So why make it bigger than what it is? Why identify with it? Cancer is not my identity. It's there, it's part of me. Why can't I consider it BP hair, diabetes hair, something like that? Why do I have to make it bigger than what it is? So there is so much more to me. I want to embrace that, take that. There's so much wonderful things happening in life. Look at the silver lining. There's always good around you. I'm taking out a book. My book is releasing in 2 months. There's so much excitement and, thing of it so having a passion, having interest in life, whatever you've had, cling to them, you know, because that's what is you. It's not the disease that is you. So it's an occasion to rise above these things and embrace life even more fully.
And you have a list of achievements as well. I think around 18 treks is what you've done.
I've done 18 visits to Ladakh for my book project, which is publishing in June. It's on the rock art of Ladakh. And I have done over 50 treks in the Himalayas. So, and a lot of them solo hikes. So I think that's somewhere, you know, everything has come together and been in my favor.
Gives you a sense in terms of the power of the mind as well. But that's an amazing story, Atushi, and kudos to you. But Dr. T. Raja, just after hearing Atushi's journey, how do you think healthcare providers and policymakers can work to improve, support, resources for patients?
Absolutely. You know, like we heard from the cancer warrior, you know, amazing, inspiring, you know, attitude. So that's very, very important. I just want to salute all our cancer warriors. The structure that supports the whole thing is the family, first of all. You know, there are amazing people, the husbands who dedicate a lot for their wives, and children looking after their mother, and so on and so forth. And so this is the basic infrastructure on which the whole success relies. Then comes the physical infrastructure, the hospital, and the several equipments that are available here. There are more modern drugs, and there are more modern equipments available. Now we have radiation equipments which are very, very precise. We called it as high precision radiation. We have drugs and different antibodies and very, very advanced medications. We call that as precision oncology. And then we have very sophisticated surgical techniques and surgical equipments. So to improve these infrastructure, that's where the partnership of the caregivers and the public and the government is very, very important. We must make sure that this kind of infrastructure is available across the country. Health should become an universal right. Our government should look at spending appropriately and adequately on the budget for the healthcare. I mean, there are various means with which we can approach health. Cost is inevitable, but there are ways to mitigate that. You can look at universal insurance scheme or something like a national or regional insurance scheme, which is already in place in many states, which can be we can bring it across the country. And then there are things that the government can certainly do. They can look at life-saving drugs and see how we can reduce the cost to the patient. They can work with the industry, and they can look at tax reliefs, and then they can look at cost ceiling for important drugs. And they can also look at actively supporting the infrastructure development, and the various equipments can be tax rebated. Finally, if we can reach a good quality care at an affordable cost to our patients, I think that's the best service rendered. Our country is going to be burdened with a large number of cancer, and that's going to happen in very, very active lifespan of our people. And these are all productive age group, that's where it hits. So there is a lot of economic sense to taking care of these patients. Investing in primary prevention and investing in education and counseling on secondary prevention, everything adds to what best we can do for this situation.
Okay, all right, that point is taken. Well, Amitabh, let's end this conversation with you. It's been a conversation about hope. Give us a sense in terms of what the future care of breast cancer looks like.
Thank you, Ekta. 40 years now, Novartis has been investing in the breast cancer space with superior science, great collaboration, and our passion to transform cancer care across the world. With regards to breast cancer, when you look at last couple of decades, it's been only a couple of years back that we came out with CDK4/6 inhibitors, which are transforming the way HR positive, HER2 negative breast cancer patients are getting treated. Wide variety of patients have been tried with superior outcomes there. We are taking a bolder approach for science. We get a wide variety of patients in our studies. We get to target mutations and pathways which have not been targeted yet, and we try to bring in newer technologies to do that. When you look at where the future is going to go, we are experimenting with living cells And these are living healthy cells of humans which are transformed and re-injected into human beings to fight cancer cells. We are looking today at newer technologies which are going to transform the way cancer treatment is done, like radioligand treatments. These are specific radioactive treatments which target the cancer cells. And last, most important, we are also using artificial intelligence to drive the drug discovery. That means that we are going to shorten the time span for drug discoveries, which generally take a couple of decades to come in, which is going to be much, much, much faster for new drugs to come into the treatment. What we basically say is that cancer diagnosis in our country is going to be on a rise. And there are three factors which need to be ensured for right treatment outcomes. One is early diagnosis. Second is right referral. The patient should be able to reach the right HCP or the right doctor at the right point of time. And the third most important going to be the right treatment that they are able to get. If we are able to have all the three in the right place, we will be able to transform the cancer journey of patients in this country.
Okay, all right, ladies as well as gentlemen, thank you for all of those insights. The emotional, social and financial burden around cancer is staggering. We need to come together and combat this. We aim to empower people with the knowledge to take life with breast cancer head on. Most importantly, our endeavor is to drive awareness and action to catch cancer early and ensure that people have access to the most suited treatment options that could increase their survival rate and help them live a fuller life. With that, we come to the close of this episode. Thank you very much for watching.